The question of whether there will be scars or not after an abdominoplasty and how hidden these scars are is a great question. It's a question that most women ask at the outset of the procedure. It's important to understand that any surgical procedure has scars, and that scars can heal in a spectrum of ways, from a very thin white line to a more thickened red or more obvious scar. Generally, these scars heal quite well, but healing is individualized. It's different from patient to patient. And so I think any woman considering an abdominoplasty or a tummy tuck procedure should kind of understand in her own mind that there will be a scar, and that to some extent that scar will always be visible if you look for it. However, we do tend to hide these scars in an area that is fairly cosmetically concealable, meaning behind a reasonable bathing suit or a reasonable undergarment, these scars are fairly well hidden. Depending on fashion styles and how low rise a fashion may be, sometimes these scars can be a little visible. However, we do tend to set them across the lower pubic region and across the lower portion of the hip area so that they tend to be easily concealed by bathing suits and undergarments and things like that. The tummy tuck procedure entails an initial consultation where the patient again is encouraged to participate in an active learning about the procedure. Our emphasis here is on education. Part of that comes from our background. Many of us come from an academic background where we're far more interested in teaching than we are in selling procedures. Our chief and primary goal is for patients to walk out of our office with a firm understanding of the procedure itself. What its risks are, what its benefits are, what the recovery's like, so that the patient can make their own individualized decision. Information is the key component to this, and so we encourage our patients to come back and to have multiple consultations if they need it. We don't charge for consultations here, primarily because we don't want there to be a barrier between a patient understanding the procedure. At the end of that, we want the patient to take that information and make a decision that's right for them. And for some patients, that may mean doing no surgery at all. But for many patients, it will mean proceeding with an abdominoplasty or a tummy tuck procedure. We're fortunate here to have our own surgical facility. We have a state-licensed, Joint Commission-accredited surgical facility, which means from a credentialing standpoint, it's very much like what hospitals go through. We're proud of that here because one of our primary objectives is also to provide safe surgery. We only use board-certified anesthesiologists to administer our anesthesia because we feel like our patients are extremely valuable, and we want to be sure that we mitigate or limit the opportunity for a complication occurring. That doesn't mean that complications can't occur, but certainly part of the education process is to help patients be aware of those. Scheduling the surgery, coordinating the surgery becomes much easier because we do have access to a surgical facility that we can have some measure of control over scheduling. Once patients are scheduled, depending on what procedures they're having, there may be the desire for the patient to stay overnight. We're also fortunate to have a state licensure for overnight stay where a registered nurse and other staff can care for the patient and their needs overnight before going home the next day. Park Meadows Outpatient Surgery Center was the first surgical facility in Douglas County over 10 years ago. It's a state-licensed and Joint Commission-accredited surgical facility. In other words, it's not just a surgical suite, which is a term often used for operating rooms that surgeons commonly have in their offices. The difference between that and an independent surgical center is the fact that there are an accreditation process and an inspection process that goes on a regular and routine basis. There are standards that we are held to that are not just self-placed standards, but standards that are recognized state standards that both hospitals and other ambulatory surgical facilities use. Park Meadows Outpatient Surgery is proud to be partnered with South Denver Anesthesia, which is an anesthesia group that provides the anesthesia services for all of our patients. This allows us to provide a comprehensive care for our patients, that we don't have to cut corners in any fashion when it comes to anesthesia and safety. Park Meadows Outpatient Surgery is also licensed to keep patients overnight for 23 hours, which means that patients who are having maybe a little longer procedure will have the opportunity, rather than going home an hour or two after their surgical procedure in the recovery room, to stay overnight under the care of nurses and staff that can then both administer pain medicines as well as observe them until the next day when they're able to go home. Patients often ask what kind of results they can expect with an abdominoplasty procedure. I think that understanding what the procedure does is as important as anything in understanding what the outcome can be. The first thing that's important to understand is that every patient is different, so your result may be different than your best friend's. I think what patients can expect, though, is a tighter, flatter, more contoured abdomen that often restores the body back to where it was prior to when significant changes occurred, whether they be with pregnancy or with significant weight gain and weight loss. Again, it is important to understand that the price of this change in contour and flattening of the abdomen comes at the cost of a scar. However, that scar for most women is well tolerated once they understand the changes that can be accomplished with the tummy tuck procedure. A tummy tuck is often combined with other procedures, particularly procedures of the breast. Often the same type of patient who is seeking a tummy tuck procedure also has had changes in their breasts, because often these are patients, whether they've had children or have lost significant amounts of weight, have also experienced volumetric changes in their breasts. To a certain extent, other patients will also combine body or lower extremity, meaning legs, liposuction procedures in an effort to contour areas of fatty tissue that just don't respond to diet and exercise. And this is very common amongst women who have had children, who have entered a different hormonal phase of life, and who notice that areas that used to just melt away with a little bit of diet and a little bit of exercise now just seem to be stubborn and stay in place despite every effort that they put forth to get rid of these areas. And so tummy tuck can be combined with liposuction. We generally do that in a cautious manner because there are studies that demonstrate that doing too much liposuction at the same time of a tummy tuck can affect the complication and safety rates. But certainly breast surgery can also be accomplished at the same time as a tummy tuck procedure. And at the time of the consultation, these are questions that can be asked of your doctor so that we can provide a more comprehensive plan for those patients who may be looking for more of a mommy makeover or multiple surgical procedures. When choosing a doctor for a tummy tuck or abdominoplasty procedure, again, I think it is the same criteria you would use in choosing a doctor for anything else. If you were choosing a doctor for your children, you would look for a doctor who's board certified in pediatrics. When you're looking for a doctor who does abdominoplasties and tummy tuck procedures, it's important, it's critical to understand both your doctor's training but as well as their board certification. I'm a board certified plastic surgeon. Board certified plastic surgeons complete an extensive training in surgery of the breast, body, and facial regions. It's a rigorous board certification process. I'm also a proud member of the American Society of Plastic Surgeons, which is an organization that upholds its members as experts in areas of cosmetic surgery and other areas of plastic surgery. So I think it is important for patients to ask questions, to understand who their doctor is and what their training is. And beyond that, beyond board certification and training, it's important to understand how often does a particular surgeon do these procedures? How many of these procedures does a particular surgeon do in their practice in a given month or in a given year? Is this something that is a big part of their practice, or is this something that they do occasionally? All of those are factors, I think, that will help patients to understand who's the right doctor for a given patient. In my particular practice, breast and body procedures such as the tummy tuck procedure are a large portion of what my procedure base is. These are procedures that I do frequently and commonly, but these are important questions for patients to ask and to enter into dialogue with their surgeon about.